Hà Lan xin gửi lời chào trân trọng đến quý khán giả. Xin chúc quý khán giả một ngày an lành và mạnh khỏe. Hà Lan rất vinh dự được quay trở lại trong vai trò người dẫn chương trình về chuyên đề sức khỏe của Regent Health. Chủ đề ngày hôm nay xin được nói về bệnh ung thư dạ dày và chương trình rất vinh dự với sự tham gia của Phó Giáo sư Tiến sĩ bác sĩ Sulo. Bác sĩ Sulo là một bác sĩ chuyên khoa ung thư rất giàu kinh nghiệm trong nghề và là chuyên gia tư vấn thăm khám tại Trung tâm Ung thư Quốc gia ở Singapore. Thank you so much, Dr. Sulo, for joining our talk show today. And Regent Health is pleased to have you today to speak on a highly relevant topic of gastrointestinal tumors. And now, please answer the questions that the audience is interested in. And the first question is, what are gastrointestinal tumors, and which are the most common types?
Hello, Ms. Lan. Nice to see you again, and thank you for having me back on. Hello, everyone. So that's a very good question. So gastrointestinal tract involves the whole of digestive system, which we start from the mouth when we eat our food and all the way down to the back passage where we pass the wastage off. So it includes the mouth, the esophagus, the stomach, the small intestines, and the large intestines. And because it's such a long tract, we usually divide into upper gastrointestinal tract and lower gastrointestinal tract. Today, we'll focus mainly on the lower parts as they both present quite differently and is quite a big topic to cover the whole tract in itself. Of the lower intestinal tracts, we divide into the small intestines and the large intestines. And the most common intestinal cancer occurs in the large intestines. And there are many types among these large intestines, which we can elaborate later.
Yeah, thank you, doctor. And are all the gastrointestinal tumors cancerous?
No. So tumors is just a description of any lumps. So some cells, when they overgrown, they become a lump. But the lump, when we term them cancerous, is when they have the ability to keep growing and keep invading into the surrounding tissues or spread to other parts of the body, such as the lungs, the liver, which are the vital organs. And once they invade into those organs, they can become fatal. Whereas a non-cancerous tumor will just remain where it is. They grow very slowly and they don't really do any harm to the surrounding structures. But we focus on the cancerous type today. And these are again, we focus mainly in the large intestine because that is where it is most commonly found.
Yeah, thank you, Dr. Sulo. And how are the gastrointestinal tumors detected?
Yeah, so it's very good questions. There are two ways that doctors can detect or patients can detect cancer. One is screening. Screening is when we do a test on patients before patients even have any symptoms from the colon cancer. So the gold standard for detecting with the screening tool is called colonoscopy. This is a device where there's a long tube where the doctor will insert from the back passage all the way around the large intestine to look for any abnormal lesions. And this serves as two purposes. One is the doctor can have a good look around inside. If they see anything abnormal, they will biopsy it. So there is a diagnostic tool. But it can also be therapeutic because when the tumor is very small, when they can remove the whole thing during the investigations process. So patient is being treated at the same time as well. But this test is need to be done by highly skilled doctors. So not all centers will have these facilities. Then the next things that we can do is called a fecal occult blood, FOB test, where we look at patients' stool sample to look for any traces of blood. And when there's blood inside, then we would send the patient to do the colonoscopy. Because one of the earliest signs and symptoms of colon cancer is bleeding from the intestine, causing blood in the stool. So that is us looking for cancer. But sometimes patients will experience symptoms and they'll come to see us early. And the symptoms they would experience could be seeing fresh blood in the stool, or losing weight, or pain in the tummy. So all these symptoms will lead us to make sure to exclude any colon cancer. So with the colonoscopy that I described earlier, we do detect a lot of early cancer that can be curable. So it is a very important test that in Singapore, we advise all patients above the age of 50 to go for this test. And I mentioned earlier, the tumor in the small intestine and large intestine can take some time to grow. So if we detect this early, we will prevent aggressive cancer forming later on.
Yeah, thank you, Dr. Solo. And the next question is, what causes gastrointestinal tumors, and are there ways to reduce the risk of developing it?
Yes, there are. We don't know one single factor that causes colon cancer, but we do know there are several factors that if we would modify our lifestyle, we would reduce the risk of colon cancer by at least 33%. So first thing is diet. What we eat, what we put into our body is very important. In the old days, before processed food became a normal food that we eat, most people would eat fresh produce, a lot of vegetables, a lot of fruits, and colon cancer wasn't a common phenomenon in those days. But now, as we become more affluent, there's a lot of processed food such as burgers, ham, sausages, and we eat a lot more meat rather than fiber, such as vegetables. That is one of the risk factors. We also know that from epidemiological study in Africa, where meat is not in such abundance, they eat a lot of roots vegetables, a lot of high fibers diet. The colon cancer incidence is not high in Africa. Being very inactive. So nowadays we are sitting in front of computers mainly. We have cars, we have escalators, we hardly do any walking or exercise. That is another factor that can increase the risk of colon cancer. So the recommendation is for everyone to do at least half an hour of exercise every day, 5 days a week minimum. That is the World Health Organization recommendation in order to reduce the risk of colon cancer. And the ways to improve all this is just by simply modifying our lifestyle and our diet. We should be able to reduce colon cancer by at least 33% in our lifetime risk. But there are other factors such as family history. So there are some genes that can make a person more likely to develop colon cancer. For this group, we would recommend early screening as well.
Yeah, thank you, Dr. Sulo. And what are the most effective treatment options?
Okay, so the treatment options we have are very varied depending on the stages and the type of cancer. The most effective for very early stage cancer, such as stage 1, is surgery still. And surgery for stage 1 colon cancer patient will lead to about 90-95% of cure. Then we move on to stage 2. This depends on the age group as well. Stage 2 is relatively early. Some stage 2 patients do not, they just need surgery without any chemotherapy, and that will lead to about 80-85% cure rate. But some patients who are younger with slightly more aggressive stage 2 cancer will need chemotherapy and surgery. Then stage 3 colon cancer patients, we usually will need to give chemotherapy, surgery, radiotherapy, all three combined together. Again, depends on the age group, the sites of the cancer. That will lead to about 75% of cure rate. So all in all, we have very optimistic success rates for patients if they are detected before stage 4. So stage 4 cancer is when the cancer has spread outside the colon, such as the lungs or the liver. In this instance, if there are multiple sites, that means more than 2-3 lesions in the lungs or the liver, then the cure rate is almost 0. But if they just one lesion found in the liver or one lesion found in the lung, we still have a good chance of curing them, up to 20% chance of cure rate. So again, the message is go for screening, go see a doctor if there's any changes in the bowel habits, any weight loss, any tummy pain, because when we detect cancer early, there's very good chance of cure, and patient will continue to live a very good quality of life.
Yeah, thank you, Dr. Solo. And the last question is, can a person recover fully from it if it's detected early and treated? And by the way, would you please give some advice to the audience on how to stay healthy as well as prevent this disease?
Yes, sure. Yeah, so when we detect up to this, even stage 4 colon cancer, if treated properly with the appropriate method, there is good chance of cure. Stage 1, very high chance of cure, more than 90%. Stage 2, around 80%. Stage 3, around 75%. And stage 4, about 20% if it's done with the right treatment. And the treatment that I mentioned includes surgery, chemotherapy, targeted therapy, radiotherapy. And what can we do to improve our chances of cure? We need to have good diet, good activities with lots of exercise, and go for screening. And any symptoms, go see a doctor. Then from there, we will advise what to do next.
Yeah, thank you so much, Dr. Solo, for joining the talk show today and answers extremely valuable information about gastrointestinal tumors. And on behalf of the audience, wishing you have a good health and more success in research and treatment for the patients. Hà Lan xin chân thành cảm ơn quý khán giả đã theo dõi chương trình ngày hôm nay và hãy liên hệ với phòng khám Regent Health chúng tôi để được tư vấn cụ thể hơn cho các bạn nhé. Hà Lan xin cảm ơn và chào tạm biệt.